Welcome back to the second part of this talk, the seminars. And we would like to welcome back all of you. Right now we're going to introduce to you Dr. Chan Kin Ming. And he's going to speak to us about right eating and also eat well, think well. Right now, let me give a brief introduction. He graduated with the MBBS in 1983, and he did his internship in the Department of Pediatric Medicine at Alexandra Hospital. And then this was followed by a posting in general surgery at Alexandra Hospital. And his final internship posting was in the Department of Medicine at Singapore General Hospital. And it was in this hospital that he developed a passion for internal medicine and later geriatric medicine. So upon completion of his master's in internal medicine, he did a short stint in the blood bank and Department of Hematology in SGH before he went to Tan Tock Seng Hospital and was among the first few doctors to start the first Department of Geriatric Medicine in Singapore. And later on, it was subsequently awarded with the Health Manpower Development Plan for Geriatric Medicine in 1990 to further his skills in geriatric medicine. And also, he did his HMDP in Glasgow, that he obtained his diploma in geriatric medicine from the Royal College of Surgeons and Physicians in Glasgow. So upon his return to Singapore, he was tasked to start the first geriatric center and the first geriatric day hospital in Singapore. Okay. Later on, he remained as head of the department, and in 1998, he was seconded to the head as the head of the Department of Geriatric Medicine at Changi General Hospital. So he remained there as the head of both departments until he resigned to start his private practice in 2000. He has published the first textbook of geriatric medicine called Geriatric Medicine in Singapore, and this became the textbook as the standard textbook by doctors attending the graduate diploma in geriatric medicine and nurses studying for gerontological nursing course. In addition, he also published another 2 books for laypersons, Common Problems of the Aged in 2001 and The Golden Years, A Caregiver's Guide in 2009. I'd like to say that I wish I had read that book because I was a caregiver, and I'm sure that I would have been able to have been, helped so much by reading that book. Yes. And let us put our hands together to welcome Dr. Chan Kin Ming.
Thank you very much for that kind introduction. Well, firstly, I'd like to thank the organizers for inviting me to speak, and more so also for this very nice venue called GEMS. And my children tell me that this is a very happening place, but since it's opening, I haven't have a chance to visit GEMS yet until today. So I can now go back and boast to them that I've been to a very happening place with very happening people like yourself. And thank you for staying back for the second half of this symposium. Otherwise, I'll be talking to chairs and ceilings and floors and walls. Thank you. Okay, when the topic was given to me, eat well, think well, I thought they must be kidding, right? Because when we eat so well, our mind becomes fuzzy, we cannot think, and we feel like sleeping, right? And I'm sure after a tea break that you had, many of you might just want to do that, you might want to be lying down and snoozing rather than sitting up and listening to this talk. So I'll just want to make it as light as possible, nothing heavy, because you have had so many lectures, you have had so many talks in the earlier part. I don't think any more things can go in. If you can just capture 5-10% of what I have to say, I think that would be my KPI That would be my KPI for today. Now, what has eating got to do with thinking? Now, I find that in many studies on children, especially malnourished children, these children do tend to have a lower IQ than those who are well nourished. They have a lower and slower learning capacity compared to those who are normal. And in fact, one study even charted that the IQ was lower by 15 points between the malnourished and the normal nourished children. So for those of you with children going PSLE, O-level, A-level, please after this rush back and cook them a nutritious meal, so that they are all ready for the exams. Now, the brain from birth will continue to develop, and by the time they reach about 30 years old, that would be the maximum capacity where the brain won't develop anymore, and that will be, and then after that, there will be a gradual loss of brain cells. So it's not as though the brain will keep on growing, but it will go up to a certain age, about 30 years old, and after that, we tend to degenerate. And although at birth, we are estimated to have about 100 billion brain cells or neurons in our brain, and the brain weighs about 1.36 kilo, but we find that after the age of 20, then we lose about 1 gram of brain mass per year. So of course, the older we are, we expect that our brain becomes smaller. So as our bones, right? I think sometimes our bones is very obvious. We can actually see our muscle, our bones sort of getting thinner. And of course, in women, with the degeneration of the bones, they actually also grow shorter when they are older. So the brain is no exception. The brain also shrinks at a certain rate. Now, is there a strong correlation between the size of the brain and intellect? There is no strong correlation. But what is equally important is not just the size of the brain, but also the density of your brain cells. So some people have very big brain, but very porous, So that type not very good, So you should thank whoever who say that you must be dense. You say, oh, thank you very much, Because I heard from this lecture that if my brain is very dense, full of brain cells, then I'm actually better off than a porous brain. And the size of the brain and the density of the brain cells within the brain itself has some correlation with nutrition. And that is important. And of course, if you talk about nutrition for the brain, it starts where? It starts from conception. That's why it's so important for the pregnant women to actually have good nutrition so that the nutrition can be taken up by the babies in the development of their brain. And of course, when they are at birth, the subsequent breastfeeding is important for the development of their brain because of all the good nutrients that there is. Now, what does the brain do? The brain doesn't just think, okay? The brain controls the movement of the body. It gives us the ability to feel pain, touch, itch, temperature. But more importantly is this group of activity that the brain does. And we call this group of activity cognition. So cognition is something that people may use, and sometimes we just don't understand what cognition means. Cognition is a group of activities, what we call higher brain function, where we are able to think, we are able to remember, then we are able to learn, we are able to anticipate, we are able to execute a plan, a certain activity, where we can have emotions, whether we are happy, angry, sad, anxious. We can learn language, we can communicate, and we can recognize. So these are a group of so-called higher brain functions, which collectively together we call cognition. And most cognitive problem starts with forgetfulness. Okay? And forgetfulness is, in such instances, forgetfulness is usually towards recent memory and not towards long-term memory. So many people have come and insist that their memory is fantastic because they could remember what happened 10 years ago, 20 years ago, but what they ate this morning, who telephoned yesterday, where did they go, an hour ago, they can't remember. And that is an early sign that there is some problem with our cognition. And in that instance, it is the memory aspect of our cognition. Now, how do we know we have poor short-term memory? For example, we may have difficulty dialing unfamiliar numbers. But unfortunately, nowadays, our handphones, we just key everything in. That I can't even remember my wife's phone number. I hope she's not here listening, or else I'll be in trouble. Because you can just dial one number, 1, and then it goes to my wife, 2, it goes to my children, 3, it goes to my clinic, and so on and so forth. So we may lose that function, that ability to remember. And when we have unfamiliar numbers that is 8 digits, then we find it difficult to complete it because by the time we 1, 3, 7, 2, 9, 8, what are 9, what are 9? And then we go all over again, dialing unfamiliar numbers or we have difficulty passing messages. That's how messages can sometimes go wrong. Can you tell someone that I will be coming at 7? And so this person passed the message, so is not coming. And so when you appear, everybody looks at you in astonishment. Hey, how come you are not here? You are here when you said that you are not coming. Or misplacing things, right? How often do we put our specs down or put our wallet, our keys, and then after that we can't remember where we kept them? And we'll be hunting high and low, searching for the things, only to find that they are in our pocket, Or obviously, the joke is always have a pair of spectacles on our head, and then we say, where are my specs, where are my specs? Or asking the same questions, have you had your lunch yet? And then 5 minutes later, oh, have you had your lunch yet? Oh, have you had your lunch yet? So you keep on asking the same questions over and over again. In fact, I had a patient where the son dropped her at the lobby while he went to park the car. And so the maid brought the patient up to my clinic, and when the son appeared, she asked the son, hey, how come you know I'm here? Because she has forgotten who actually sent her here, So they forget lists of things to do, they forget names, they forget faces. So these are some of the things that may prompt us that, maybe our short-term memory is not that great, it's getting worse. Now, earlier on, this is a repetition of that slide. Not that I'm repetitive, please. I knew that this is a repeated slide, and I put it that way because I want to remind ourselves that basically cognition is a matter of the higher brain function involving thinking, memory, planning, emotion, language, recognition, and so on. But when memory, together with some of these, gets affected, get impaired, to the extent that it affects our daily life, or maybe it affects our job, then that becomes more serious. And we usually call that cognitive impairment. And the commonest cause of cognitive impairment is actually dementia. Okay, so when we look at the definition for dementia, it is impaired memory, impaired language, impaired motor function, impaired recognition of objects, impaired planning, severe enough to impair social or occupational functions, but it is not because of other reasons, because we have been high on drugs or because of other head injury and other secondary causes. So dementia is just an umbrella term to define impairment of the brain, and there are many types of dementia. It includes the one that we are most familiar with, that is Alzheimer's disease. One of the most famous presidents of US, Ronald Reagan, has Alzheimer's disease. That's why it generated a lot of interest in this area of dementia. And then the Parkinson's disease, then you have Lewy body disease, you have vascular dementia, frontotemporal lobe, and you have many other types of infections like the mad cow disease that subsequently affects the brain and then cause dementia. So a brief word about Alzheimer's is a slow onset, and usually it starts in the older age group, but in some instances it can occur as early as 50 to 60s, and 65 years is a cutoff age between what we call early onset and late onset. So if we are early onset, that means we have dementia 65 years and below, younger than 65. There is some genetic basis for that. But if we have dementia above the age of 65, usually that is just because of old age degeneration. Okay? And of course, the cause of the Alzheimer's is usually due to abnormal proteins clogging up the brain, affecting the normal functioning of the brain. And because of these abnormal proteins, the brain cells die at a faster rate, and so the brain shrinks faster, right? And certain parts of the brain may shrink more than others, like the frontal lobe, and so that affects memory, and in time to come, even long-term memory. It may affect the temporal lobe, so that affects emotions, that affects mood, and the people so affected can be very moody for no particular reason, can be agitated for no particular reason. Okay? Now, there are many other factors that may cause a condition that is similar to dementia. That's why when someone comes to us with very poor memory, cannot think, very crowded in the mind, spaced out, we usually do a series of tests in order to find out whether there are other causes that is interfering with the normal functioning of the brain. And we usually check the electrolytes, low sodium is a very well-known cause. And somehow the cardiologists are very good because they educated their patients so well that if you have heart disease, you cannot take salt. And so the older person do not take salt, and over time, you find that their sodium level become very low. And every time they come in, I got to put them up on a sodium drip, and when they go out, they stop taking salt, and so that they keep on coming back for salt replacement. So it doesn't make sense. So I always tell them, please, you need salt, unlike other heart patients, Otherwise, your brain cannot function if your sodium levels are too low. Of course, vitamin B12 is important, diabetes is important, certain infections may cause a condition similar to dementia, chronic sleep deprivation, kidney failure, and in some instances, depression can look like dementia, and therefore it is sometimes called pseudo-dementia because it is a false type of dementia where the cause of it is because of depression. Now, I have put this in green because these are nutrition related. Okay, these are nutrition related. When you have low sodium, we have low B12, where you have diabetes, or when your nutritional state is so bad, you are also very prone to infections, and therefore this can be a nutritionally affected condition. If you are taking medications, like Valium, on anxiety medication, tranquilizer, antihistamines, this can affect your brain. And of course, alcohol abuse, and I have a few cases where they actually develop alcohol dementia, okay, because alcohol is a toxin for the brain. So these are some of the blood tests that we usually do to exclude the causes that may affect brain function, and in some instances we will need to do a brain scan in order to look at the structure of the brain, whether there's any stroke, whether there's any shrinkage of the brain, and which part of the brain has shrunken, and that may give us an idea what type of dementia we are dealing with, because depending on the type of dementia, the treatment is of course different. So what can we do if we are suspected to have cognitive impairment? Firstly, we need to improve the condition where the brain functions. That's very obvious, right? Because we have to optimize the condition for the brain to function best. And that means that we need to control the pressure properly, we need to control diabetes properly, we need to control the lipids properly. So whatever pre-existing condition you have, make sure it is properly controlled. And secondly, we need to protect the brain cells. And if we know that alcohol is a toxin to the brain, it's toxic to brain tissues, then we should sort of control our intake of alcohol. And smoking is definitely bad for the brain because it affects the circulation to the brain, and the carbon monoxide levels goes up, and all sorts of toxins that we inhale, so we have to stop smoking. And stress management is important. Relaxation exercise, yoga, meditation can help us to improve our brain function. And we know this for a fact because even young children, very intelligent, go into the exam hall, and the moment the exam papers are flipped open, their mind blank out because of stress. Suddenly they can't remember anything, right? So stress is important. And lastly, we need to improve brain nutrition, and I'll go through a series of slides which sometimes we loosely call it brain food. Okay, so I think Singapore, no lack of brain food. In fact, instead of remembering all these, just know that you should eat as many colorful fruits as possible and as many different color fruits and vegetables as possible, because each of these color would confer some degree of antioxidants, some degree of vitamins that the body requires, and that is protective for the brain. So all the berries, the blue, black, all these are red, raspberry, purplish, avocado, orange, grape, cherries, apples. So these are important brain fruits for us. Similarly, for vegetables, again, the sprouts, the spinach, broccoli, beets, the peppers, onions, all these contains very good antioxidants for the brain. Omega-3, these are essential fatty acids that are required for brain health because they are important for normal functioning of the brain. So we need to take omega-3, and they are available either in tablet form or in natural form. For example, the salmon, the sea bass, sardines, bluefish, herring, mackerel, tuna, trout. So one meal in a Japanese restaurant and you'll have the brain food, except that it's expensive way to get brain food. But these are some of the fishes, a variety that is useful. But if you are not talking about those, you are talking about plant-based food that are rich in omega-3, then the walnuts, the flaxseed, soya bean, and of course there is this blue-green algae, the spirulina, which we use to feed our koi's. But somehow they are very good for humans as well, because they are very rich in omega-3. So these are things that are also helpful as part of the brain food to help to boost up your brain health. Now, other things that has been proven to improve cognition would include things like ginkgo biloba, ginkgo biloba. But unfortunately, it is not found in the fruits. It is found in the leaf. So if you go to the Chinese medicine shop, you buy 1 kilo, one day 1 kilo. I don't know what ill health it will have, but you are barking up the wrong tree, because it is not found in the fruit, it is found in the leaf. Okay, so ginkgo biloba. And similarly, Panax ginseng. So the next time you go to a Japanese restaurant, the next day you go to a Korean restaurant for ginseng chicken. Because Panax ginseng has been found to improve the learning capacity of older and younger. These are animal studies, and also in middle-aged human participants as well. So these are things that sometimes we, even as Western-trained doctors, tell our patients that, yeah, you can actually take that because it can be helpful. Okay? Vitamin B, very useful, important for nerves, and therefore milk, fish, almond nuts, cereals, the shells, oysters, eggs, cheese, and meat, all these are very rich in vitamin B12. Okay? So if you look at all these, you find that a lot of it are found in animal products. And so vegans, those who are very strict vegetarians, you may have a problem getting sufficient vitamin B12. So usually, I think it would be good practice that if you are a very strict vegan, do not eat eggs and no milk, then once in a while, you should check your blood levels for vitamin B12. Because I have found so many of them that have such a low levels, and that has affected their memory as well. Okay, vitamin B6, same thing. We find in spinach, beef, meats, sunflower seeds, fish, bananas, avocados, dried fruits, nuts. So you have a healthy diet of a bit of each every day. I think that would be very good advice for all of us. And similarly for folate, also another vitamin that is very good for brain metabolism. Okay? And they are found in all the green stuff, the green leafy vegetables. But folic acid is water soluble. So if you cut your vegetables into small strips and you wash it, chances are that you will wash away all the folic acid. Secondly, it is heat sensitive. So if you boil them until they are very soft and you eat them, then you will lose the folate as well. So you should be taking them roughly raw in the form of salads, or if you want the soft ones because you don't have teeth, then probably the avocados would be easier to eat, and you don't have to boil it or cook it or wash it in any way. Okay? And vitamin E is, of course, again, see, almonds, nuts, walnuts, peanuts, all these have very rich minerals, vitamins that are very good for the function of our brain. Now, if we want to keep our brain sharp, if we want to be fast thinker, if we want to be in a tip-top condition, it cannot be just by eating alone, right? So we have to keep our brain sharp by using it, because we either use it or we lose it. And hence, we always advise our patients, on top of doing your exercise, walking, you should do some crossword puzzles, play some cards, Sudoku, and what we call practice other-handedness. So I better use my left hand and point. This is called other-handedness. So if you are used to writing with your right hand, then once in a while, practice, train with your left, because you are actually using different parts of your brain to do that action. If you brush your teeth with your right, then after a while, you try to do it with your left because you are using other parts of your brain to do it. So basically, you are training your brain to do new things. And then learn a new language. If you love Korean shows, then learn the Korean language. Learn to sing the Korean songs. Or learn music. Learn to dance like, I don't know who is hot now in the Korean scene. or have some computer-based brain training programs which I regularly download and play for myself. You just Google mind games, or memory training games, and then they will come, and then you just play with it until such a time they say, okay, you have to pay. Then I delete the program, and then I download another one. Cheapo. Okay, of course we have to live healthily, no smoking, eat a balanced diet, moderate alcohol, active social life, go out with your friends, chit-chat, talk about everything, read books and so on. Because you find that when you sit among friends and talk, there is no particular subject that you talk. No one is going to sit around and say, what shall we talk about today? You just sit down and whatever comes your mind, you just talk. And because of that, your mind have to quickly shift gear. Talking from food to politics, to your neighbor, to the dog, to religion, to your neighboring country. So everything moves around at a very fast pace and you have to sort of catch up. And therefore that is good for the brain. And of course, in a chit-chat kind of atmosphere, it is non-threatening. And therefore you can relax and enjoy it. It relaxes you, it is stress-free, and so it is helpful for the brain. Okay? Increase your physical activity. Just by walking, by brisk walking, by swimming, doing your treadmill and all that, it is useful to improve our memory. Memory improved when 72-year-olds started on a walking program 3 days a week, and when they did scans, they showed that their brain activity actually improves. So just by physical activity alone is helpful if we are able to do so. And of course, it's important for us to have adequate rest because sleep deprivation is something that will make our mind very tired, and therefore we will not be able to think. Don't stop being curious, and hence you find that the government has been pushing on the lifelong learning. Every one of us is given $500. Have you used up your $500 yet? Haven't. So after this, please go and look for a course, and I do have a few patients, very well motivated, they actually sign up to learn how to cook. He's an engineer all his life, and now on retirement, he was telling us how he deboned a fish, and he actually at the end actually can get a cert. Then after that, he will go and learn how to bake cakes, So things like this that we never do before, maybe we never had time to do before, but if we do it upon our retirement or when we have time, even whatever age we are, that will be things that we learn and that will keep us interested, and of course as an opportunity for us to make new friends and get out of the house rather than just lying down in bed watching TV, which does nothing except to make us weaker and weaker by the day because we are just so comfortable as a couch potato. Okay? Or if we really have nothing else, then please remember volunteer with some homes, with some charities. There's always need of people to help because it again gives us a reason to get out of bed, a reason to get out of the house, an opportunity to make friends, and an opportunity for us to learn something new. So I think with that, thank you very much for your attention.
Do you all have any questions and answers that you'd like to pose to Dr. Chan? Yes. Somebody is coming over to with you.
Hello.
Thanks.
Thanks for the talk. I just wonder whether the medications we take for the hypertension and for high cholesterol will affect our cognitive ability.
Okay, I think that is a very good question. Now, I know that on the internet, and people believe the internet more than doctors, right? They will say, oh, statins, very bad for the brain. But in the past few years, and even up to the last dementia conference that I attended, all the experts are in the understanding that statins, lowering blood cholesterol, lowering blood pressure, is important to prevent dementia. Because if you look at one of my slides where we talk about the different causes of dementia, let me just quickly go back to that. Yes, that's right. You see this column called vascular dementia. Vascular dementia basically means that the vessels are very small, and because of that, the blood circulation to the brain is affected, and to a certain extent, some part of the brain even have a small stroke, but it is so small that we don't feel the effect, the deficit, the weakness, but on the scan, we actually see small holes happening in the brain. And that comes on when our blood pressure is not controlled, and that comes on when our cholesterols are high and not treated. And therefore, if you heard of people saying or still saying, now we use that term fake news, then I think it will be our responsibility to actually educate them that it is not true that statins affects cognition. In fact, statins help to improve cognition. Thanks for giving me an opportunity to talk about statins. I think it is important.
Do you have any more questions from the floor? Is this lady out there? Could you pass the microphone to her? The roving mic is coming to you.
I'd just like to tap on to this earlier question. What about thyroid medication if you are taking it for the rest of your life?
Okay, thyroid medication. Now, if we look at thyroid, metabolic disease, thyroid. Now, the problem with thyroid, as I mentioned here, is either hyperthyroid. That means your thyroid is overactive. So your brain is in overdrive. And people with a high thyroxine level, they are usually very anxious, and because they are in overdrive, they have mental fatigue. So we have one group that is hyperthyroid. Then you have another group where it is the other extreme, hypothyroid, where the thyroxine levels are very low, and because of that, the metabolism, the brain function becomes very slow. And so they are very sluggish, they cannot think properly, they are sleeping all the time, they are mentally fatigued. So either both extremes will give rise to a condition that may look like, that may mimic dementia. But once we treat it, for the hyper, we give them medication to suppress it. For the hypo, where you don't have enough thyroid, we give you a thyroxine to replace it. Once it goes back to normal, then you find that your brain function normalizes. So in other words, the consumption of thyroid medication do not in any way impact your cognition. In fact, it will improve it whether you are hyperthyroid or hypothyroid, and you are bringing it back to normal.
Dr. Chan, thank you for your very enjoyable sharing. I got two questions here. One is that from what I see, dementia is actually affecting that of short memory. So what causes long memory loss? And the other thing is that all the measures that like taking to food and also that of playing cards and so on, these are actually a rectification kind of method. So if let's say dementia has kicked in, is there any way to improve the condition?
Sorry, your second question, what is a repetitive type of...
No, what I mean is that actually all those measures like taking healthy food, doing exercise and all those things, mind games and so on, I believe those are before the condition kicks in. If once dementia comes about, doing all those things helps.
Okay, all right. You see, she tested my short-term memory. I can't remember what was the first question. No. Okay. Now, of course, when dementia comes on, it affects short-term memory. Long-term memory is usually resided in the frontal lobes. So if there is also loss of long-term memory, then that could mean that either the frontal lobe has shrunken more, in which case it may not be Alzheimer's, it may be the frontal temporal dementia, which is another type of dementia, but still dementia, okay? Or that the patient have a stroke at that part of the brain that interferes with the long-term memory. Okay, so that is the first question. Now, the second question is that what I have shared is not just for all of us to do before the onset of dementia. In fact, all the more, even after the onset of dementia, they are also and equally important. That is why nowadays when we are looking at managing a patient with dementia, we very often cannot rely purely on medicine. Okay, we have to send them to a dementia day center. Where the dementia day center, they have structured programs like what I have mentioned, you know, playing with them, jigsaw puzzle, play mahjong, you know, teach them photography. I think one of my patients, you know, had a pottery session. They learn to paint pottery and they have excursions to go out, talk about plants, go botanic gardens, and so on and so forth. So all this will continuously stimulate the mind. And of course, it is done as a group, so there is social activity, there is chit-chatting, you know, and it's very relaxing, and there is a lot of walking along the way. So everything all lumped into one in this kind of programs that are found mainly in the dementia day centers. But of course, if the elderly do not like to go out, some of them, they tend to be not very sociable, you know, and they may not be sociable all their life, therefore it's nothing new, and they refuse to join, then of course the family members may have to do that themselves lah. You know, whenever they are free, sit down with them, name cards, you know, play mahjong, bring them out, learn something new with them, and so on. So it is still important. Okay, it's not purely to prevent. Okay, at least by doing this, we can reduce the rate of decline, the rate of deterioration of their dementia.
Right, thank you. I think that we have to wrap up this session. So we are not taking any more questions from Dr. Chan. We'd like to thank him. So would you just give him a round of applause?